Thank you, Dr. Mahmoud. First of all, I will speak as a community member, not as health professional. So you will see the slide is just very simple. And first of all, I want to speak about the Liverpool MRC. And Liverpool MRC is a non-governmental organization that's for non-profit, and it's community-based. That means the board represents from the local community. And as you see, our vision is to work with refugees and migrants who would be in disadvantage for some reasons. And we do that through different type of advocacy, capacity building for individuals and for community. And I will go through our annual report for 2013, which shows how many people, it's not clear, sorry, but I want you to see the 8,276 people has been coming to our front desk. So they've been assisted either by going to a casework or going to a complex management program, or by just giving information and referral. And with this, we're looking for these issues in the same year. So accommodation, financial, and then after the legal is health. And when I talk about health, in our settings, we can't talk much about immunization, for example. We talk as general health issues. Go back again to the second is document help. With this document help, we help people to fill forms because they can't fill the forms. It's very complicated, and the English is very limited, which include health forms. Even for admissions, it's a huge impact on our caseworkers because they are not health professionals. But let us go for health. So health for them is not a priority if it does not have a direct effect on them. So immunization is not an issue for them as having accommodation. It's not an issue if they can't feed and have a food. And so on. So this is why they may be late for immunization or for health check or catch-up of immunization. And I'm going back to this, it's just a bit of scientific thing, but let us think about it. So either lack of acceptance is one of the major issue in Australia, but for the refugees, is not. So they're willing to be immunized. They have the experience either home or when they are in refugee place. They're already immunized. They may have lost their records. They don't remember, but it's not an issue for them. So the other issues may impact, which like cultural issues, some religious reasons, which is still very low in our community, refugee and migrants, especially in our area in Liverpool. And also education. And health education is a big issue for us because I'm here talking as a community member. So in my country, for example, not because I'm a pharmacist, but if I'm a normal person, the doctor never asked me, do you like, we need to give you antibiotic. It's not my call. You know, give me antibiotic. It's just confusing for them to come to an area, they've been asked, what's best for your health? Do you want to take this or not? It's just confusing for them to take because they don't have the knowledge to make the decision. Okay? So what I think we need to work with them to give them this power, which is knowledge. Okay. So we'll continue with barriers. we did research with Dr. Mahmoud in Liverpool Hospital Emergency Department, and we found that the refugee and migrants who live in Australia less than 5 years has less access to emergency department. And this is at a general, because if we go we did go and investigate, even to go to GP is an issue for them. So they don't know where to go. They don't know where they can get their child immunized. Okay. Culturally appropriate service, as I mentioned before, is very important to decrease this gap. And I give you here a case scenario. It's not last week. A lady came to Australia as a spouse. When you come as a spouse to Australia, you don't have any funding from the government. So that means you're not eligible for social security payment. And you depend on your case, where you're coming from, you may have access to English classes or not. So they will be assessed by the Department of Immigration. So this lady came to me with immunization card that's in Arabic from Sudan. And she said she has a letter from Centrelink show her that if she didn't, Medicare and Centrelink, if she didn't show them the records and being registered, she would never get paid. Payment here is for the child, who is a citizen, and for the father, who is a citizen, not for her. So I just investigate. I found that father isn't only in social security payment, so he gets about $100 a week, fortnight. And the child, I think, 190, something like this. So they pay more than $320 a week for rent. Okay, and this card is in Arabic, and she has to translate it in English. And that's why I put here funding, because these are things we never think about. So we're pushing people to do things. We don't know their situation. So we need to consider some funding to help those people to be registered and then take the stress, because we know trauma and other things affect their life. And that's will go to the same no job, no pay. It's the same thing I want people to consider when they work with the refugees, to consider those elements and things they never thought about. How that's stress themselves, these refugees, how that impacting their life and mental health. There's all this issue. This is my kids. They're already immunized. I'm very proud of them. And yeah, I think that's what I want to say just today.
Thank you very much.